Hi, nursing students. This is NurseEdScholar here. And today we're going to dive into the topic of fluid volume deficit, which is also known as hydration. Okay. So, when we're looking at this, the goal is going to be to restore fluid volume, replace electrolytes, and address the root cause. But before, we're going to be getting into all this, but let's just start. So, dehydration occurs when the body's fluid intake is insufficient. The patient is just not getting enough fluid intake to meet the body fluid needs. Okay. And like I said, so the goal is to restore the fluid volume, replace electrolytes as needed, and to eliminate the cause of that fluid volume deficit. So when we're looking at types, so we're going to talk about types and causes and assessment, but first we're going to talk about types. So there's isotonic, hypertonic, and hypotonic dehydration. So when we're looking at isotonic dehydration, it's when water and dissolved electrolytes are lost in equal proportions. This is also known as hypovolemia. Isotonic dehydration is actually the most common type of dehydration. And isotonic dehydration results in decreased circulating blood volume and inadequate tissue perfusion. So the most common type of dehydration is isotonic dehydration, and that's when water and dissolved electrolytes are lost in equal proportions. Okay, so moving on. Hypertonic dehydration is when water loss exceeds electrolyte loss. So, clinical problems that can occur because of the alterations in the concentrations of these electrolytes, what happens is that the fluid moves from the intracellular compartment into the plasma and the interstitial fluid spaces. So when you lose more water than electrolytes, the fluid inside the cell starts going into the plasma because now there's a loss of plasma volume or blood volume. And so they're trying to get that water or the fluid back into the plasma, and it goes into the plasma in the interstitial spaces. And so because you're pulling that water out of the cell to kind of fill back up the plasma, it causes the cell to become dehydrated and shrink. So that's hypertonic. And now hypotonic dehydration is when the client is losing more electrolytes than water. So clinical problems will happen when the fluid shifts between the compartments. So it's causing a decrease in plasma volume. So the fluid moves from the plasma in the interstitial spaces into the cells, causing the plasma volume to become less and causing the cells to actually swell. So now hypotonic is where the water shifts from the plasma, it goes into the interstitial fluid spaces, and then it goes into the cells, and now your cells are starting to swell. and that is because of hypotonic dehydration. Okay. Causes. So how does fluid volume deficit, what causes this? So when a person has isotonic dehydration, yeah, there is a loss or there is an inadequate intake of fluids and solutes. And so, we talked about that fluid shifting between compartments. So, uh, isotonic dehydration is due to inadequate fluid intake. Now, let's move on to hypertonic dehydration. This is when there is an increased fluid loss, such as in excessive perspiration, hyperventilation, ketoacidosis, prolonged fevers, diarrhea, early stage kidney disease, and diabetes insipidus. So here we are having excessive fluid losses, and that occurs with hypertonic dehydration. And then lastly, hypotonic dehydration is caused by chronic illness. So excessive fluid replacement, uh, kidney disease, and chronic malnutrition will cause hypotonic dehydration. Okay? So, how do we identify fluid volume deficit? So, we're going to look at each in each area to say, okay, what are we going to look for as nurses? What are nurses assessing for? So when you're looking at the cardiovascular system, you're going to assess fluid volume deficit. The patient will have a thready and increased pulse rate. They may have diminished peripheral pulses. They may have a decreased blood pressure and orthostatic hypotension. They may have flat neck and hand veins when they're in an independent position. Um, the patient may have decreased central venous pressure, and they may even have dysrhythmias. When you're assessing for fluid volume deficit in the respiratory system, you will see an increased rate and depth of respirations and dyspnea. Assessing fluid volume deficit in the neuromuscular system, you'll look for decreased central nervous system activity, like lethargy, tacoma, skeletal muscle weakness, and fever, depending on the fluid loss. Assessment of the renal system, looking at fluid volume deficit, you'll see a decreased urine output. Assessing the integumentary system, you'll see dry skin, poor skin turgor, tinting, and dry mouth with those who have fluid volume deficit. With the gastrointestinal system, you will assess fluid volume deficit. You'll hear decreased gastric motility. They may have constipation, reduced body weight, and thirst. And then lastly, in your assessment of identifying fluid volume deficit, when you're looking at laboratory findings, the patient will have an increased serum osmolality, an increased hematocrit, increased Blood urea nitrogen level, or another way of saying that is an increased BUN. The patient will have increased serum sodium levels, and they'll have increased urinary specific gravity. So those are the laboratory findings that you'll see with fluid volume deficit. So as our role as nurses, it's pivotal. We need to uh, discover, well, not really discover, but we need to implement interventions to prevent further fluid loss. And like I said, restore fluid volumes, and we may even have to provide oral and IV hydration. So, as a nurse, we're going to have to, like I said, prevent any kind of further fluid loss, and increase the fluid compartment volumes to normal ranges. So with that, we're going to be providing oral hydration therapy, IV fluid replacement if the dehydration is severe. We're definitely going to monitor intake and output. Um, when we're looking at the different types of dehydration, isotonic dehydration is treated with isotonic fluid solutions, hypertonic dehydration with high polytonic fluid solutions, and hypotonic dehydration with hypertonic fluid solutions. We'll also, need to correct correct or help prevent further losses, like we discussed before, and alleviate any symptoms. So you'll see orders for antidiarrheals, to prevent the diarrhea that's causing this fluid loss, antiemetics, stopping that vomiting, which will increase fluid loss, antipyretics. We talked about fevers, excessive sweating, which causes fluid loss. So you'll see antipyretics, and even antimicrobials. You calm down the infection, you'll calm down the signs and symptoms of it, which would let's just say fever. Um, and so that will also reduce fluid loss. And so the main thing is to correct the loss and treat any symptoms that the patient may be exhibiting. And lastly, we need to monitor uh, electrolyte values and prepare any medications. All righty. So that's kind of what the nurse's role is, and with fluid volume deficit. So that's a quick summary of fluid volume deficit. Thank you for watching Nurse Ed Scholar, and stay tuned for more insights in fluid and electrolyte dynamics. And, think of it this way, the more we understand, the better we can care for our patients. Okay. So happy nursing.